We have Supervisor Cindy Chavez, who will provide information and then do questions and answers. Cindy, you're on mute.
Oh my gosh, I told you guys something so funny too. I won't be able to do it again. I'm so glad to hear all of you. I'm sorry I can only see a few of you. It's good to see you though. And I wanted to, I know Jason had to leave, or he's still here. He is such a great representative for the San Jose Police Department. I miss working with you very much, and I'm really excited that you're helping the East Side community. So I thought maybe what I would do is just take a minute to talk a little bit about COVID-19, and then I would really like to stop talking and make sure I can answer questions. As all of you know, we have done as a community a really good job of flattening the curve. I want to thank all of you so much who've been helping both, sheltering in place and doing what you can to support our neighbors. Two very exciting things that are happening in our community. One is that we have expanded our testing program to come out further to the east side. And on Friday at Tropicana between 10 and 2, you can do walk-up testing. You do not need an appointment, and it's the nasal swab. It's not the one that touches your brain. It's the one that Dr. Marty Fensterscheib has been showing everybody all over the place how to do. And what we're looking at is expanding that to put more mobile units on the east side that will be able to work with neighborhood groups like yours to inform the public about how to get tested. The second thing is that on Tuesday, I put forward a referral asking my colleagues to support a promotora program so we could do health education on the east side. And really this is to offer a face-to-face socially distanced mechanism for making sure that small businesses and individuals and people who are working have an opportunity to social distance, make sure they have masks, and that we're educating people about how to protect themselves and their families, but doing it in a more face-to-face way, although socially distanced, so that people are safe. And then the last thing that I just wanted to add is that we're looking for volunteers. So if any of you would like to volunteer helping with contact tracing, what I'm going to do in the chat is I'm going to put my email address. And the reason for that is I left my the direct address, but I'll make sure that it goes to them. And this is if you are interested either in the promotora program and you'd like to volunteer for that, or you'd like to volunteer to be a contact tracer. And what contact tracing is, I'm sure all of you are experts at it now, but this allows us, if we think someone's been exposed or someone has been exposed, and we know someone's been exposed to somebody who's COVID-19 positive, we have a chance to talk to them, find out who they've been exposed to, and if they need isolation or quarantine, we can help with that too. So with that, I'm just gonna stop and answer questions.
All right, thank you. So the first question is, who should be going to the testing sites for COVID-19?
That is an excellent question, because what we were telling people is you had to be symptomatic. Now you do not have to be symptomatic. We are looking for everybody who would like to be tested. So at Tropicana on Friday between 10 and 2, anybody can show up. And as a matter of fact, last Friday, with almost telling no one about it, we were able to test 171 people in 4 hours. So it's a pretty fast test, actually.
All right, next question is, are face masks going to be required in San Jose? I see too many people walking around without them, and some stores posting these as required, yet no one wearing them.
Yeah, so the city of San Jose did a first reading of an ordinance, and actually Woodham may know more about this than I do, that will require face masks. The county's requiring them in all places of business. VTA is requiring them to ride the bus. My recommendation is that people wear them as often as they can. It's safer for you and it's safer for other people to do so.
Okay, next question is, I was wondering, what are the city and county doing to help small business owners, non-essential, who can't get reduction from landlord? Small business owners like me can't occupy our business due to shelter-in-place order. they're having to pay the rent in full for something they can't use. Rent forbearance is not assistance.
Yes, I wish I could have better news. There are two things that the county offers. And again, you can use my email that I just sent out to everybody. One is that our Human Relations Department will mediate between any landowner and the renter. And through those mediations, what we're trying to help people do is pay less or come up with a strategy to pay less over a longer period of time. And it is true, our moratorium, it only protects people from being kicked out. It doesn't protect people from the payment. That's right.
Okay, let me see. Is outreach being conducted for non-speaking redirects regarding availability of COVID testing sites or food pantries?
Could you read the first part of that question again?
Yeah, I'll try to translate it because it says non-speaking redirects.
So,
So,
they
yeah.
probably mean English, yeah. So good question. And that is that if you call 211, if you want to give anybody who doesn't have access, for example, to the internet, they can call 211 and get information about the closest place for them to get food and the place for them to get testing, including if they want to do a walk-up test. For most locations, you still need an appointment. You still need to make an appointment, even if it's a walk-up, even if you don't have a car. But at the mobile sites, like the one on Tropicana, you can just show up. If you go to the county's website and you look up Santa Clara County Health Department, you'll see on there a whole list of places that people can be tested, and it's translated. You can click to have it in Spanish, Vietnamese, and I think Mandarin.
What kind of time commitment is required to be a volunteer tracer?
What an excellent question. So the training is a little over 20 hours. We're asking people to at least have 3 months to dedicate to it. And most of it is a little bit of, if you're good at home on Google, you'll appreciate this because it's using Salesforce. You'll get trained on how to do that. You'll call people up, you'll get their information, input it, so that we can share that data and make sure that we're tracking everybody down. There is some face-to-face work, but I think most of that will be done by public health officers. But if you're multilingual, that's even better. For being a promotora, it's even easier, right? It's being culturally having other language skills, and the training for that is probably about the same amount of time.
So it looks like those are all the questions for the county. I'll just note my impression, I reviewed the county's dashboard for cases and hospitalization data daily, and my impression is that shelter in place, mass social distancing is working. I think today I saw that we're down to 50 some individuals hospitalized. That's, obviously any hospitalization is tragic, but it's over probably 80% dropped in the last 4 to 5 weeks. So is that your sense that things are improving?
Yes, and I think that, part of the reason I'm so excited about the opportunity to really bolster up contact tracing, and we're going to need almost 1,000 people to help us, and we're getting better and more at testing, is the more people we test, the more we can determine how prevalent the virus still is in our community. And I'll just give you an example. I was talking to one doctor who told me that for the first 4 weeks that they had tests, that almost 40% of all the people they tested came up COVID positive. The last 2 weeks that they've been testing, they've had no one COVID positive, and that's the right direction because we want to be making sure that we're lowering not just the number of people who are hospitalized, but really getting rid of the virus in our community overall. So I think we're moving in a good direction. It's partly why we're opening up more and more, and we'll continue to do that. One last thing, and I really will say this to the business leaders in particular that are on the call, starting, and I don't know what days we're going to be doing this, but over the next 10 days, we're going to do 2 days of hearings to work on how businesses and communities can open up safely. and to be able to share what we think are going to be best practices, because we want people to be able to hit the ground running as they open up, both deliberately and safely, so that customers feel good about coming into their stores, and we feel good about shopping and riding public transportation and all those other things I know so many people want to get back to doing.
All right, there is one final question, and that is, what is the county doing to support or help small mom and pop home providers, because we still need to pay property taxes, mortgages, plumbers? Please help.
Small mom and pop what?
Small mom and pop home providers, I think that's a reference to individuals who rent properties and are not major developers, for example.
So one of the things that I have been doing is to participate in fundraising through the Silicon Valley Community Foundation for Small Businesses. And they have a very easy form to fill out to get a little bit of relief from them. The second is the moratorium that we've done so that no business can be thrown out of the property if they are renting it from somebody else. We just did an extension of that countywide yesterday. The other thing is that, you know, I think it's going to be incredibly important that we, you know, as a community, really do our best to shop with small businesses once the community gets back open. And I think that the brunt of this has really hit our small businesses. For sure, it's hit our small businesses harder than anyone else. So partly it's helping through fundraising, and then hopefully if there's anything else that you think of that we could or should be doing, you know, I just gave you my email address. Please send me a note. I'm happy to work on that and think about that and hopefully get to work with you. You know, can I add one other thing? Just, you know, for a lot of you who are employed still right now and working from home, one other thing we're doing is trying to figure out how to partner with, you know, with businesses to see as many people that can stay working from home who like doing it. Because some people who I think never thought they could work from home are finding they're really effective at it and successful at it. And the other is that even as we start to open up the economy, we're still going to have people who have weaker immune systems or who are older and who may have underlying conditions that really need to be able to stay safe longer. And so the county, along with other employers, are really looking at ways to make sure folks can continue to work from home if it's safe for them to do that. So, which I think is a good direction for a lot of people.
All right, and I just want to echo my personal opinion, which is now is the time to shop local. If you can order from a huge company online and save a buck, it probably wasn't worth it. Just go down to the store or shop local, whatever it may be. Again, that's just my personal opinion.
Me too.
All right, so thank you, Supervisor Chavez.